Okay, I'm going to move into introducing our speaker for today. Hi, everyone. Welcome. I'm Sydney Ortiz. I am a psychologist and assistant professor, and I'm the clinical director of the Adolescent Health Center. I also co-lead the Department of Psychiatry's DEI Community Engagement Subcommittee with Dr. Naomi D'Amberville. I'm excited to introduce Just Talks, an equity and social justice lecture series brought to you by the Department of Psychiatry's Diversity, Equity, and Inclusion Steering Committee. This year's theme focuses on the relationship between psychiatry, mental health, and social determinants of health. And with that, I'm excited to introduce Dr. Mardoche Sidor and his lecture, Breaking Barriers, Understanding Social Determinants of Mental Health Through Real-Life Cases. Mardoche Sidor, MD, is a quadruple board-certified psychiatrist specializing in general adult psychiatry and neurology, child and adolescent psychiatry, forensic psychiatry, and addiction psychiatry. Currently, he serves as a part-time geriatric psychiatry fellow at the Mount Sinai Behavioral Health Center. Additionally, Dr. Sidor is the medical director for Urban Pathways, a nonprofit organization in New York City dedicated to providing care for individuals with serious mental illness and substance use disorders affected by homelessness, justice involvement, and other social determinants of health and health disparities. In his role as founder and CEO of the Sweet Institute, supporting well-being through empowerment, education, and training, Dr. Sidor is committed to enhancing mental health education and training for medical and mental health professionals. He also served as a clinical assistant professor at Columbia University for 8 years from 2016 until February of this year. Dr. Sidor's extensive experience includes serving as medical director for the Center for Alternative Sentences and Employment Services, a New York City organization providing support to justice-involved youth and adults with mental health, physical health, and substance use treatment needs. He has also held the position of medical director at a multicultural wellness center in North Philadelphia, where he provided care to vulnerable populations. In addition to his clinical and educational roles, Dr. Sidor is dedicated to advocacy and community service. He sits on the board of trustees at Project Renewal, a New York City-based homelessness organization, and is a published author of 13 books. Dr. Sidor is also a sought-after public speaker addressing topics related to mental health, addiction, and social justice. Dr. Sidor, we're so excited to have you. Welcome. Thank you for joining us, everyone. Dr. D'Amberville will now share how to collect your continuing education credit.
Hello, everyone. I'm Dr. D'Amberville. So thank you again for joining us today at Just Talks. So continuing education credits for today's talk are available to psychologists who registered for CE and are available for free to Mount Sinai affiliated physicians, nurses, psychologists, and social workers. Information about collecting CEs and CMEs will be placed in the chat during the course of the talk. If you didn't register via Eventbrite with your Sinai email and would like to obtain CE credit for your attendance, please use the chat to send us your full name, credentials, and Sinai email to myself or Timothy Stahl, who's also a panelist. Lastly, if you're joining as part of a unit or a group, please note each person's name and credentials in the chat so we can capture your attendance. If you have any questions about continuing education credits, just again, put them in the chat and myself or Dr. Stahl will respond. Today will be a very interactive chat, so we really encourage comments, reflections, and responses for Dr. Sidor in the chat box, and you're welcome to put questions in the Q&A. So with that, Dr. Sidor, welcome.
Thank you so much. You see, in family therapy, as all of us know, it's often said that the goal of the first session is to have a second one. And well, today you have chosen to be here, and I am extremely grateful for your presence. And I am extremely grateful for this opportunity to all of the planners and the staff to have this conversation. Now, why we say conversation? Because we've all been led to believe that the best way we learn is to have someone talking at us. And that's our traditional way of learning, nothing necessarily wrong, except that Research shows that when that happens, we barely remember 10% by the end of the lecture. And 1 week later, we barely remember 1%. Now, of course, we cannot actually deny the value of lectures, but we can ensure that we remember, all of us, that what truly matters more than information and knowledge is implementation. And it's been shown that implementation is enhanced when we get to engaged. And part of being engaged has to do with the use of the inquiry process. And I just wanted to quickly explain why we're going to be using more the inquiry process. And as part of today, if at the end of today, each one of you get to say one thing you're going to be doing either differently or more of or less of as part of addressing navigating social determinants of health, we will be able to consider this time together as being successful. I would like us to at least start with the following case, and then we will take it from there. I'm going to go ahead and share my screen. All right, so here's the case, and then I'm gonna just quickly read it, and then we'll have a few inquiries. Now, by the way, these inquiries are not to test us or to challenge ourselves. It's just about stimulation as we start this discussion. So this is John, 32-year-old man with a history of childhood trauma, substance use disorder, frequent encounters with the police. He's been in and out of jail and prison with a number of crimes, including drug possession and theft. And currently he's seeing us, any one of us, and complain of insomnia and depression. And many of those symptoms are exacerbated by obviously his experiences of trauma. So there's stress and of incarceration and all that. Now, his chart shows a number of diagnoses, from ADHD to schizoaffective disorder to antisocial personality disorder. And of course, despite his desire to change his life, all of us know that he does have a number of barriers to accessing healthcare, stigma, and a number of financial resources, including lack of social support. And one thing that comes to mind right away is obviously the social determinants of health. And if we were to go back, I would like to quickly ask you, as part of thinking together, in your own words, what are social determinants of health? What is that term that we keep hearing, we keep using? It's been sometimes now. What is that? In your own word, what is social determinants of health? Well, I did promise that, and part of the most important part is really asking the question. And whether you actually use the chat box, I'm sure you know you're able to chat or not, I would like us to think about these inquiries, and then feel free to put whatever comes to mind. And of course, one of the ways of operationalizing social determinants of health is the idea of a number of conditions in which individuals are born, right? But not just born, grow, live, work, and age. Now, we know also those social determinants of health are considered as a wide set of forces that shape the conditions of daily life. Now, the World Health Organization has come up with the 15 clinically most relevant social determinants of health. Anyone can cite any of them. Again, no right or wrong answer here. What are some of the most, in your practice, what are some of the most commonly clinically relevant social determinant of health would you come up with? Okay, so thank you. Yeah, economic status. Anita, thank you. We know that actually economic status happens to be the number one prognostic factor when it comes to whether someone with any type of mental health condition does well or not. Wait. Let's take a step back. Let me repeat this. My socioeconomic status is the most important prognostic factor that determines how well I do with my mental health conditions. Now, what does that tell you? And the reason why I actually asked that is because we do know that we have a lot of efforts going on at all levels, but how much effort is then put in addressing that idea of my economic status, when regardless of how many medications I'm on, regardless of how much therapy I receive, and all of these have their place, but my prognosis is truly very strongly determined by my economic status. Thank you, Anita. I know Samarinda Andra said environment. Yes, very good. We have actually food, indeed, and which actually makes me think of something we'll be talking about today, which has to do with Maslow's hierarchy of needs. Anthony, internal factors that can be changed. Yes, homelessness. So I think it's nice. All of us are coming up with those different types of clinically relevant economic social determinant of health. Now, what about the impact then? So we are aware of the fact that social determinants of health play a crucial role, but in reality, practically, what would you say is the impact of social determinants of health in the lives of the patients and clients we serve? What do you think? What's the impact? Social stigma, Walter. Thank you. Social stigma. And we do know that that stigma has it in turn a ripple effect. Any other type of impact? Yeah, so there's access. Access is another. Access itself is really a social determinant of health, yet it's also a ripple effect, a consequence of these same social determinants of health. In reality, if we are truly thinking about it, it's like a vicious cycle, right? It's like our patients and clients are actually trapped, right? And yes, as Jessamine is saying, there's that feeling of powerlessness. And of course, there's internalization of that. And Renana is talking about anger. I like that. Yeah, so there is a lot of impact. Taylor is saying energy spent on these and they are discouraging and distracting. Yes, because now, why is that? I love this. Why is it? And by the way, the follow-up inquiries are for everyone. So Taylor stated energy is spent on this and they are discouraging and distracting. And why is that? What would you say is missing? What is missing that actually tends to lead to that level of discouragement and yes, and disempowerment? What is that about? So there's a lack of hope. And why is that? Why is there a lack of hope? And by the way, many of you would agree that a lot has been tried, right? And which we hope we have time to really go over that. A lack of a try, but something is missing. And again, today, as we said, if we get to leave each one of you at least identify one thing we can think of differently, do differently, or do more or less of, that will be a success. So what actually is missing? So Anne says there's a feeling of, Louis says that there's, okay, now that was not Louis, opportunity for growth because spending energy just trying to achieve the basics. Thank you, Louis. Carl, feeling powerless, that's right, to change the social determinants of health that are impacting someone. So yeah, so why is that? Why is that there's such a feeling? And by the way, Carl, great job. Is there that feeling is shared by both patients and clients and us clinicians. Would everybody agree? And why is that? Why is there such a feeling of powerlessness? Because again, a lot has been tried, but what's happening here? So mistrust, Renana says, Anita, making a systemic issues a burden to the individual to solve. So part of really what is going on has to do with the following. So Einstein says, and I quote, if I'm given 60 minutes to solve a problem, I will I will use 55 minutes to understand it and 5 minutes to solve it. Okay. Now, I I actually suspect that we would all agree we actually understand social determinants of health. And I don't think really anyone and I don't think you would be here. Actually, you here because you understand the importance, you understand the impact. But which takes us to the next part of what we're trying to say. Einstein also said, and I quote, we cannot solve our problem at the same type level of thinking that created them. And that is where we think we have something to think about. What are we currently doing to help solve these issues, to help navigate this aspect or that issue of social determinants of health? What are we currently doing? What approach are we currently using? Anybody? What do you see? Again, no right or wrong answer. What do we see among ourselves at the hospital, in the clinic, anywhere else? What is really happening? So Jessamine says connecting patients to existing community resources. Samarendra says reactive response and solution. Reactive. And thank you for that, because that takes us to problem solving, right? So the idea of problem solving, there's a problem, and many times we try to solve a problem and we create more problems than we started with. And why is that? Because indeed we fail to go to the root of the issue. And as Samarendra is saying, there is more a reactive stance. There is more of a reactive stance. And now let's say each one of you here is placed at a position where you are making the decision to navigate and address the social determinants of health of our patients and clients. Each one of you, you have all the power. There is nothing that can stop you. There are no barriers. You have everything at your disposition, right? Just like really a version of the miracle question. What would you do? How would you proceed? How would you address our patients and clients' social determinants of health, understanding that these represent the number one factor that will determine how well they do and stay? Understanding that recovery is not possible without addressing these social determinants of health. Doesn't matter really what else is tried. What would you say? What would you do? How would you proceed? So Samarendra say better public transportation. Anybody else? Thank you. Thank you, Samarendra. Now, understanding that public transportation is only one of the clinically relevant social determinants of health. So what then what would we do then with the other ones, Samarendra? Just, I mean, honestly, if I could do anything, I'd give everyone a livable income, good health insurance, and a place to live. And what is now, which is, you have a great heart, Jessamine, and thank you for that. Now, what's missing in this? Why is there still a missing link? Despite that, we will get to that. But thank you, Jessamine. I like that. Change health insurance, early childhood intervention. So Anne is talking about prevention. Anne is talking about systemic structural and systemic changes. Okay, bringing services. So you see how we have a lot of great ideas. Michael is saying bringing services to community, right? So there, I'm hearing prevention, I'm hearing systemic and structural changes, I'm hearing addressing those individual needs. And unfortunately, many of you agree that we have a number of programs that are doing a little bit of all this. Yes or no? Yeah, some programs are working on structural, systemic, public transportation or access or food insecurity or housing. Would people agree? Yes. Thank you, Carl. Yes. Yet, do we still have a lot of problems with addressing the social determinants of health? And the question is, what is going on? What's missing? What is the missing link? And once again, today, if really we get to live here with at least one thing, that I hope that really we get to go at least to something that will, one thing that will make a difference. So just to before we shift gears, yes. So the impact, as many people have been saying, is health disparity is a big problem, right? And the health behaviors of our patients and clients really, and even interconnectedness, and health equity. So we do have a number of impact, right? And a number of systemic factors that also have been mentioned: structural racism, socioeconomic inequities, and many of you talked about access, and of course, all those environmental factors. So there are a number of actual aspect. Yet we've already agreed that a lot has been tried. Unfortunately, a lot is still missing. And as a result, I'm going to ask you, of all the different strategies that have been developed to address social determinants of health, what is one model we could use in order to ensure that there is a step-by-step approach that may be used and followed and become successful? What is one approach? And the answer you already know, but the question is the application thereof. So just for the sake of time, how many of you are familiar with the Maslow's hierarchy of needs? Everybody will say yes. Yeah. How many of you are familiar, remember the Maslow's hierarchy of needs? How many of you have actually made use of Maslow's hierarchy of needs to address the social determinants of health? Always, sometimes, never. And what do you think about making use of Maslow's hierarchy of needs to actually help address the social determinants of health? What would that look like? And with that, I'm going to actually stop my share for a while so that I can shift to the next part of for today that I actually want to get to, and so that we can actually get into this specific topic that we are talking about right now. Okay. So which is evaluate what has been shown to work. Here you go. So we've already identified that, at least mentioned, we have a number of approaches, but these approaches have been limited. Now the question is why, I ask. And there is actually one specific part, which is not that obvious, but once we talk about it, we can see why. And then we're going to be talking about Maslow's hierarchy of needs. So here's the question, and I would like to hear from as many of you as possible. What do you think is the role of empowerment in in navigating the social determinants of health? I'm gonna repeat the question. What do you think of the role of empowerment in addressing the social determinants of health? Anybody? The role of empowerment. Yes. Thank you, Naomi. In addressing the social determinants of health. Thoughts? Samarendra, people have to believe they are capable of change. They need confidence in themselves. Thank you, Samarendra. What do people think about that? They have to believe that they are capable of change and they need confidence in themselves. Now, by the way, self-confidence is what number in Maslow's hierarchy of needs? And thank you, Samarendra. A terrific answer that helps us really advance what we want to talk about for the rest of this time. So what number is that? So self-confidence is actually number what? It's actually number 4, right? In Maslow's hierarchy of needs. What's number 1? Number 1 are those physiological needs. People need, yes, that housing and then food insecurity needs to be addressed, right? And then we have to move on to safety, right? As the need number 2. Both of those represent the basic needs. However, it means we have to start there. But unfortunately, do we have an actual plan to help move individuals to what Samarendra mentioned, that self-confidence? I actually with Colombia back in 2015. I helped establish a specialized unit that was actually sponsored by the mayor's office, and the goal was to look at that time, there were about 10,000 individuals incarcerated among all the 10 jails. And among all those 10 jails, we had so many different individuals incarcerated who were they were hurting themselves, hurting others. If you remember we're talking about 2015, if you remember back in the news, we had individuals who were hurting the staff, hurting the correctional officers. And when we looked at their charts, they had 100,000 different diagnoses. They were on 100,000 different medications. And the idea was for us to actually work with them. Of course, we evaluate them and assess them and then establish a treatment plan and all that. I'm saying that to say, and then violence rate. Now, with our interventions, the violence rate decreased really to single digit. But here's what we found out. Number 1, structure was one of the main reasons why not only they were recidivating, they were like there would be back and forth at Rikers, but number 2, why there was so much violence. And then number 2, more importantly, was what Samarendra talked about, the idea of sense of self-confidence. And this is actually something that unfortunately we may need to start talking more about. And thank you again, Samarendra, for bringing that up. And because the question is, what is the role of empowerment in addressing social determinants of health? I was born and raised in Haiti. And I don't know if you see Haiti currently in the news. And back in 2010, if you recall, there was a big earthquake. And the UN came out with a report stating between 1980 and 2010, 30 years, the number of help aid organizations helping Haiti had multiplied by the hundreds, literally. Yet, it's shown at the same time that during that same period, poverty has increased. Things got worse from a level of functioning. And the question is why? And it's been shown that that's exactly what we are talking about here. Unfortunately, there is a problem with lack of empowerment. And it's been shown that when we are giving a fish, which is important, it needs to be accompanied with also teaching how to fish. And this is why I like Samarindra's answer around the idea of confidence. And empowerment means our patients and clients, we help them get to a point where they can tap into that resource, that what we call resilience, and what allows them to recover. And this is actually one of the aspects. I hope that, again, this is really for many of us, for some of us, that may be a start of a conversation. But I hope if each one of us really start thinking about this. How do we operationalize the idea of empowerment, which is not obviously a new word, which is happening somewhere, but how do we make this happen more often? How do we actually inject that idea, that concept, and that approach of empowerment as we navigate social determinants of health? Because again, it's been shown, if I am giving a fish, not only that when there is no fish, nobody actually gets a fish, number one. Number two, it's been shown that there is that sense of psychological dependence where individuals have to wait, right? And number three, therefore, this is what many of you already mentioned. Individuals get tired, individuals feel stigmatized, individuals feel that they don't have what it takes, individuals feel that they're broken, especially we know that they've been affected by so much trauma, and individuals feel that really they actually are less than. And unfortunately, if we are looking at Maslow's hierarchy of needs, when the basic needs are met, we move to the third need, which is what? What's the third need? The third need is indeed community and love and belonging. And then the fourth need, which is self-confidence, sense of self. And unfortunately, for sustainability to be achieved in addressing the social determinants of health, we actually need to look at a model that includes empowerment. What do people think about this? What do people think? And I'm going to go back to the same question, right? What do you think is to be the role of empowerment in addressing social determinants of health? Once again, I love Samarendra's answer. People have to believe they are capable of change. They need confidence in themselves. And then the follow-up inquiry is, how do we do that? How do we achieve that? How do we actually help individuals gain that confidence in themselves? Anybody, what do you think? How do we actually help individuals gain that confidence in what does it take? And how do we ensure that that sense of empowerment, that sense of confidence is part of our treatment plan as we address the social determinants of health? Anita says people also need the resources to make changes. I love that. And like Anita said, what types of resources that people need to make those changes? What are they? And these resources, how do we ensure that we actually infuse the idea of empowerment in every type of intervention that we are doing or we are conducting? Carl says it feels important for both the patients and practitioners to feel empowered. Wow, to address social determinants of health. I love this a lot, Carl. What do people think about Carl's answer? It feels important for both the patients and practitioners to feel empowered to address social determinants of health. So the idea of we cannot give what we don't have. And I think really this is something often enough we hear. And I know that many of you here who teach, who actually supervise, and you often mention that the idea of we cannot give what we don't have, but the more we have, the more we can give. Carl, this is brilliant. I'm curious to hear, and the follow-up inquiry therefore is, what does it take then for to have this synergy or to have this scenario where both the patients and practitioners are empowered to address social determinants of health? What does it take? What does it look like? What does it take? What is needed in order for that empowerment to be present and to be shared? As Michael says, this is extremely important. It's essential. Renana, empowering indeed is key, and have knowledge that they are their own or their children. Absolutely, Renana. So have you heard, I also work with geriatric patients. And one of the things I realize is that many times they come, they don't know what medications they are on or what they take it for, what they take them for. And we also know that many times the home health aides don't know and the caregivers. And sometimes we think, wait a minute, how do we help how do we infuse some level of empowerment where we have that diet, caregivers, and home health aides and the patients to actually really to empower them to find a way to have that level of information. And we do know that one of the reasons why we have a number of errors overall and a number of mishaps is because of this basic level of education. And yes, I really like when you said when you said that, Renana, having older people involved, and which takes us to the next point, the idea of community. So empowering our patients and clients requires, as Carl says, that the clinicians are also feel also empowered. But it also means we're going to have to extend beyond the clients. We're going to have to use allies and making sure that there is some form of mobilization of the community support, community resources. How many of you actually are making use of the community to help address our patients and clients' social determinants of health through empowerment, right? And Anusha says self-confidence is much higher, comes after the basic needs are met. Yes, I love that. And that's exactly why it's really not all or nothing. It's the idea is while we are making sure that we're addressing the basic needs, how do we also have some form of a roadmap? In other words, I'm not focusing just on one thing. I have a roadmap. And how many of you agree that, just like somebody said earlier, it's more reactive? Because it's more reactive, it's easy to just focus on one thing and forget where we're going. And this is what I think, as part of navigating the social determinants of health, one thing, or this is what I think we may start thinking about. When I say start thinking about, wherever you go back to, wherever you are, both all of us, thinking about how can I help address the social determinants of health to empowerment, right? But empowerment of actually both patients and Willie and me as a clinician. But number two, ensuring that yes, I am focusing on what's needed right now as a means to the bigger picture, that self-confidence, that sense of self, that level of empowerment. And then number three, how do I go about doing that? By actually involving the community. Really, really great. Thank you, Anusha. Really well said. Okay, so I think another part, so Gabriela says early education could be key to start empowerment. Thank you. So the other part is the idea of advocacy, which then needs to center on the idea of prevention. And yes, that actually takes what we call awareness. And that's exactly what Gabriela is centering, is talking about. Now, how much awareness do we really focus on when we are addressing social determinants of health? And by the way, can one person do everything? And that's a rhetorical question, which means how many of you agree that we need to truly focus on doing this together as part of a multidisciplinary plan, team? So early education, which means prevention, awareness, advocacy. How many of you are involved in some form of advocacy efforts, one way or another, geared towards addressing social determinants of health? And if not, how many of us support those who are engaged in some form of advocacy effort? Stacy says increase self-awareness, self-efficacy, educate people about the systems that impact them. Okay, very good. So education. Okay, very good. Now, let me now go ahead and I'm gonna stop my share. And so that when then we're gonna move perhaps to actually the last part of today. Now, I know we actually use the conversation to make some of the points instead of actually going in order, and that's why I will be repeating some key areas that I know we've both come up with, we both agreed on. And the first one is number one, well, social determinants of health are important. I'm speaking as I'm actually looking for my next slide right now. So so social determinants of health are important. Number one, we all agree with to that. We all know that. Number two, there is an impact, big impact. And number three, we know that whatever has been done can be done differently. Why? Because unfortunately, we still have some shortcomings. And then number four, what can be done differently? We agree that while we need to focus on doing what needs to be done now, we need a roadmap. And that roadmap may be through the use of Maslow's hierarchy of needs, as we are making sure that we're taking care of the basic needs, but we're also keeping our eyes on the need number four, which is sense of self. Why? Because this is how we help individuals achieve the idea of are empowered enough in order for them to actually be able to address those needs, of course, along with us. Now, I know many clinicians actually happen to laugh at the idea of recovery. Oh no, these are chronic, seriously mental illness. And unfortunately, many of those social determinants of health, they are mostly present, right, in many of our patients and clients with serious mental illness. And therefore, I'm gonna be asking that question. And then how much time do I actually have? I think
So we have about 10 minutes
10.
for more conversation Q&A. So if you want to
Okay.
integrate that.
Thank you. Thank you. So, so I'm gonna, before we move to this call for innovation, which we've started talking about, because if we're talking about ensuring that we use a model of empowerment to address social determinants of health. And as many people agree, that model needs to be that empowerment needs to be shared by both clinicians and patients. We also then need to really agree that it takes some spirit. So and then part of the spirit has to do with our attitude and belief. How many of you actually believe, to use that term, in what we call a recovery-based model? How many of you think that, yes, people can recover? There is such thing as recovery, a recovery model. I'm curious. Walter said yes. Thank you, Walter. Anne says yes. Jessica says yes. Okay. So many of you actually really so this is the perfect crowd, actually, the perfect audience, right? The perfect audience. Thank you for that. So yes, and in this case, then we know that individuals, if we believe that individuals can recover, we know that it doesn't matter what the level of condition is. It's just a matter of a roadmap. Okay, so we said that we need then to innovate as we're talking about empowerment. Talking about the idea of community. We need to see how we actually can have some innovation infused into addressing the social determinants of health in such a way that we can see some concrete result. Well, we have already talked about advocacy, right? But we also need to think about the idea of breaking away from traditional methods and explore some novel methods, some novel intervention. And then what could be that level of novel intervention? So we definitely need, as we said, need to collaborate, needs to be multidisciplinary, needs to break away from that vertical leadership, and goes to horizontal leadership, understanding that every single person, every single staff, it doesn't matter what their type of license is, has really something to bring to the table. And of course, that helps with the diversity aspect, with creative thinking. And of course, we need to adapt. And that's why, even though we talked about the plan earlier, it's more about a strategy. Because when we have a strategy, we can adjust, we can adapt, and we need to be able and willing to actually adapt as we really move towards all that. And to actually end, because I just realized that actually I don't think we have that much time left. I would like to ask you, what is one thing from what we discussed and within this time frame, what is the one thing you actually would like to start doing as a result of today? As a result of our conversation, as a result of this time, what is one thing you would like to either explore more, or do more of, or less more of, or do it differently? Anybody? As I said from the very beginning, would like us to see whether we could identify one thing. Has anybody been able to identify at least one thing they would like to think of? What is that thing? Thank you, Stacy. Anybody else? And what is that one thing you think you actually, yeah, I would like to think more of this. Look for more information on this, more research, more data, or more conversation, or more training, or more conversation with my patients and clients. I don't know. What is it, right? What is it? Um, so Sydney, continue to think about how to foster empowerment in the work I do. Thank you, Sydney. Samarendra, develop a better framework. I like that. Resources, I appreciate it. Thank you. I like that actually. So a better framework. And by the way, obviously the big picture is empowerment, for example, but then everybody's not gonna be at the same place. So it's gonna be tailored. So some people, it needs to be physiological needs. Other people, it's safety. Other people is social support. So it needs to be tailored, right? It needs to be in a way where we really truly meeting people where they're at, right? Really, really good. Um, Very good. And let's see. Oh, the hierarchy. Thank you, Taylor. The hierarchy. Thank you, Dr. Rosenfield. I would like to share Maslow's hierarchy with patients and ask what level key would like to work on. I love that. This is actually pretty creative and innovative, actually. So that's a great implementation. Thank you for that. How to facilitate my own empowerment and resources, knowledge to then empower patients. Yes, Stacy, I love that. The more we have, the more we can give indeed. And really, and one of the things we can do in addressing social determinants of health for our patients, with our patients and clients, is to model for them. And part of the modeling, indeed, Stacy, is really empowerment, can be through empowerment. I really love that a lot. That's really brilliant. Thank you for that. Gabriela, promoting the idea that anyone who is a part of a team, any specialty has something to contribute. Yes, including patients in advocacy to promote empowerment and hope. Yes, indeed, and helping our patients and clients understand that their own participation in NAMI, for example, that's part of their empowerment. That's part of their own really addressing those social determinants of health, not just for themselves, but also for their patients and clients, right? And Gabriela says also putting the hierarchy of need up in my office to reference session. Thank you so much. This is really great. This is really, really, really great. Now, Naomi, do we have more time or?
For about two more minutes.
Okay, perfect. Okay, so I would like to actually end with the following, right? And as I said, this is a problem that is easy to make any one of us as clinicians feel overwhelmed. However, as we said, part of the feeling overwhelmed is because we think that we are the one to necessarily to do it alone. And if we now take a step back and agree to actually get the patients and clients, their family members, and the community as allies, number one. And number two, the strategy is shifted from just giving a fish, but also to empower how to fish while also making sure that the acute issues are taken care of. We will be able to grow and to also prevent our own burnout as clinicians, our own cynicism, but also, and then be more hopeful and also be able to ensure that our patients and clients can model after that and really get to the point they even model for others. If there is at least one of those things that actually really stimulates you enough to go and really do something as you have mentioned, then I think that may have been a success. Thank you for the opportunity, and we're looking forward for the feedback on how we actually could have done this differently. Naomi, back to you. Thank you.
Great. Thank you so much, Dr. Sidor. We'll see if there's any questions, but as we wait, I just want to take a moment to just maybe summarize some key points in what you shared and points that people were making in the chat. I think a lot was said. I think there was so many thoughts and reflections coming up. So it feels like in highlighting certain moments of our conversation, Dr. Sidor, you gave a great overview of how to integrate and address social determinants of health in the clinical encounter, right, as physicians, as clinicians, and in our communities. And throughout the conversation, people have expressed, and try to really understand the role of stigma, right? The role of sort of the health disparities, our own personal reactions as clinicians and individuals, including feelings of not being enough, doing enough, right? Despite all the great ideas and facts of the world, right? We kind of know this, like people need money, people need resources. And so the answers feel so accessible and yet they're not happening. And so this sense of powerlessness that people were kind of expressing to really like address these disparities given the boundaries and limitations of our role, but our desire to do more and more, right? So I think that what I took away and what I'm sort of noticing in the chat is that you allowed us to really feel or encourage us to kind of feel empowered to work hand in hand with our patients to really like apply and model the hierarchy, these frameworks you've been discussing, hierarchy of needs, collaborating together on advocating, maybe even the idea of allowing your patient to set the hierarchy of needs, right? Allowing them to sort of understand how to advocate or what they want to advocate for, even if that might not be our goal or even the point of the appointment today, right? And in being like really innovative in accessing resources so that we can do our very best in providing equitable care and increasing hope. But hope was that word that I saw time and time again throughout the course of this conversation. I don't see any questions. And so I guess the last question I want to leave you with, Dr. Sidor, is in the next minute, do you feel like you can share a little bit into your personal journey into psychiatry and community engagement and what has inspired your work?
Yeah, thank you, Naomi. And in terms of a few ways I could answer this question, but what I've found truly to have made the biggest difference, you have said it, is truly to the idea of meeting individuals, our patients and clients where they're at, and but what does that really mean? Really, it's really just a few simple question in terms of what really would make the most sense right now. So we know that between anthropology and medicine, we know something known as explanatory model, right? So and their explanatory model will happen then to be paired with their solution model. And then from that, we get to use their actual language in order to bridge that gap. I think if we have quick time very quickly, I remember there was someone who was refusing medications. They were gonna take him to court, and then I'm back on vacation. I'm talking to him, and I'm asking him, "What do you think is going on?" And he said, "Well, there is a evil eye." And I said, "What do you think needs to be done for that evil eye? I need to be stronger. What do you think you need to be stronger?" He said, "I don't know." I said, "If you think you could actually if I give you a prescription, a medication to help you get stronger, would you take it?" He said yes. And then that's around the time where risperidone was very common. He did pretty well. And then he actually went back to school. What's the more of this? Speaking people's language, truly meeting them where they're at. And that really has been one of the biggest lessons I've learned in that. So thank you for the question.
Thank you so much, Dr. Sidor. So thank you again for joining us today. Thank you everyone for joining and participating. We hope that you enjoyed this talk and found it relevant for your practice and the work that you do in the communities that you serve. So thank you for joining us. Please feel free to email us about any CEs. Feel free to, share your comments or thoughts, and I'm happy to pass it on to Dr. Sidor. And a recording of this talk will be posted on the Just Talks page on our Psychiatry DEI website. So looking forward to seeing you all in our April talk. Thank you.
Thank you so much.
All right.
See you later. Bye.